How well do you know your husband? How well do you know your wife? How well do you know your sister? How well do you know your brother? How well do we know each other? Good evening. I'm Guthrie Munyuki, and welcome to this week's program. Tonight on the program, we are discussing clinical psychology, mental health, and some of the ramifications that we are beginning to see in our society as a result of the illegal substance and drug abuse. Tonight, to discuss that with us on the program, we are joined by the founder of Gateway Mental Health and Drug Rehabilitation Center, Dr. Farzana Naeem. Dr. Farzana Naeem, good evening.
Good evening. How are you?
I'm all right, thank you.
Okay.
I know that people are accustomed to Dr. Farzana, so I think we'll stick to Dr. Farzana.
It's okay. It's
Sure.
okay.
Dr. Farzana, what do you do in clinical psychology, and what do you do here at Gateway Mental Health and Drug Rehabilitation Center?
Okay. So, as a clinical psychologist, my job is to assess, diagnose, and treat people with mental health related issues and drug abuse. Um, as I'm in the profession for last 17 years, and I have been observing that people are increasing in numbers in terms of drug abuse and mental health related issues. And we are talking of awareness about mental health related issues and drug abuse, but we are lacking behind in terms of practical solutions. Since relapse is very high among people who diagnose with specifically substance induced psychosis and hallucinations and delusions. So at Gateway, the aim is to provide like a halfway home and rehabilitation. So when they are discharged from the hospital, we can keep them for minimum 1 week, 2 weeks, even 1 month or 2 months. It depends on mild to severe cases. And we help people who are struggling to deal with the drugs and who want to start their new life after the healing. The aim to keep it here that they don't relapse. They don't, because some might be abusing drugs or substances because of peer pressure. So if a boy, 18-year boy, abusing substances, and we are sending them after the treatment, same environment, and we are not doing proper detoxification process, so what will be the result? They will relapse, ending up. So at rehab we keep them, and then it's not like only we are admitting here people. Actually we are into a lot of recreational activities, and our aim is to teach them some skills, like we do have a music teacher and dance teacher here. We do some games, yoga, meditation, relaxation. So there is also like cooking and baking. So it all depend what is your interest. So during this rehab period we teach them some sort of skill, so when they are discharged from there they should have something to practice. As we can see that mostly people they are very much unemployed, and sometimes they don't have lot of things to do, you know. So they can result in a boredom, and they are lonely, so they want to abuse substances. So that's why we want to, you know, teach them some skills also, so once they are discharged from here they have something to do, or they create some interest in their activities. So we are providing here daycare service. For instance, if you are having a, you know, a relative who is having, might going through depression or any other mental health illnesses, or even into drug abuse, and you don't have anywhere to keep, you have to go to work. So we offer like you can come 7 a.m. and 5 p.m. So we provide like a daycare service. Yes. Yeah, so even if you have to travel and there's nowhere you can leave your depressive sister or brother, so you can bring to Gateway. And we also do offer weekly admission, and also the monthly one. So it all depend according to whatever the assessment and diagnosis.
Dr. Farzana, what you are describing is not just a situation that is limited to just your services here, but it is actually pervasive and very universal in this country. I know that you also teach at the University of Zimbabwe. You also work with the authorities at one of the country's, even the country's biggest hospital, Parenyatwa. But we're not going to talk about what you do at Parenyatwa. We want to talk about the problems in the society. So, how bad is the situation? Because you're discussing hallucinations, you discuss